historically there were strippings and ligations and very invasive things that, from what patients I see that have had those things done in the past, the recovery was long. And currently now,
now, if I could cut you off for a moment, what was that? What was a stripping or a ligation?
they would go in and try to just pull out either the abnormal vein that was leaking, or they'd go in and pull out the varicose veins, or a combination of both. And a lot of times people had scars all over their legs. The recovery was 8 weeks, and
very invasive, it sounds like.
It was very invasive. The procedure we most commonly do now for reflux is what's called a laser ablation. And basically it's about a 20-minute procedure. We take the laser from the lower leg, position it in the upper leg under ultrasound guidance, and after a few injections along the catheter, we just withdraw that catheter, and the catheter basically boils the blood inside the vein and scars the inside of the vein so it clots off, and then over the course of time shrinks up and goes away. The varicose veins tend to get better on their own after you treat the problem. There are patients that have kind of a spectrum of disease that may not be coming from the saphenous vein, but it's still a superficial vein, and they're not veins that are amenable to lasers, so we treat those with injections. And there's 2 different chemicals that are available, and we can just take little needles, stick them in, squirt the solution in, and it does the same thing chemically that the laser does.
I see. Now, I understand spider veins are a different kind of a problem.
Yeah, spider veins, they're just in the venous spectrum of disease. They very rarely cause any symptoms. That's almost always a cosmetic problem. I suppose that there must be a hormonal influence because they're far more common in women, and certainly the most common patient is a woman who wants their legs to look nice. In general, most of those are treated with injections as well. There are a few that can be treated with a surface laser.
And is the success rate pretty high for having spider veins treated and them going away permanently?
Yes, but what I tell all my patients is if you have spider veins, you're a spider vein former. So we can make them go away, but you're probably going to have other spider veins crop up in different places. So you tend to see patients that have spider veins, they have to come in for maintenance injections periodically.
I see. Another issue is deep vein thrombosis, and
yes,
that sounds more serious.
That is more serious. Pulmonary embolus, which is a blood clot to the lung, comes from deep vein thrombosis, and that's like the #3 killer in the United States. Over the past 5 years, we have had great advances with devices, and now we can actually treat the DVT, preserve the valve function, and hopefully prevent the blood clots from going other places.
We certainly wish we had time to talk more. I'd love to have you back on our show later on. I appreciate you for being here. Thank you very much.
You're welcome.
That wraps up our show for today. If you'd like more information about this show or any other program on GHS TV, visit GHSTV.